Hello, happy new year, happy 2022 everyone, and welcome to Talking Health with DrLaz, your favorite health program on television. Yes, anywhere you are watching us from, reaching you from your channel of choice, AIT, from Nigerian capital city, Abuja. My name is DrLaz Eze. Yes, today, the first show in the year. We're very happy to be here with you, and I'm sure everyone is excited to have transitioned to the new year, 2022. And a lot is going to be happening within the space, the political space, and of course, the health sector. We are going to track that. One of the conversations that started late last year is how to bring health into the political conversation. So this year, there's going to be a lot of politicking within political parties towards the 2023 elections. And on this show, we are going to ensure that we push for health to be topical, because without health, we have nothing. Okay, so on the program today, we're essentially going to be showing you some highlights of the conversations we had last year, beginning from January 2021, some of the programs we had, and just playing it back to refresh your memory. And of course, they are all on our YouTube channel, Talking Health Nigeria TV. So we're going to take a very short break, and when we return, we'll begin to show the highlights. Do stay with us. We'll be right back. We made this post on social media and asked the question, are you going to support a second lockdown? And there's a response you made. You said, lockdown, no. We can deploy other means to cope with the situation. There is hunger in the land. It could kill more than COVID-19. I know a lot of Nigerians share this sentiment. For me, hunger in the land is more of an emergency situation and worse pandemic than COVID-19. Can you expatiate on that?
Yes, if you see people flouting the rules of COVID-19, it's because they are looking for survival, because they are hungry. So you cannot restrict them at home when they are hungry. So I feel that we could deploy other means of coping with the situation without going to lockdown. Yes.
So Nigeria has some of the best health policies. But in terms of implementation, it doesn't translate, at least in the past, to better health for mothers, children, and all that. So with this new innovative approach the ministry is taking, how will it translate to better quality of service to Nigerians on the street?
Yeah, so this is actually the crux of the matter, is to ensure we have better outcomes, matching our efforts at the national level. And what I did not mention as part of this partnership are also the traditional institutions and community leaders. They play a great role. So what will be the game changer, and this is what we want to work towards in 2021. We want to see that not only developing policies, frameworks, guidelines, building capacities, it just ends there. We all recognize the delivery platform. It's not the Federal Ministry of Health. It's not the federal government of Nigeria. The delivery platform is at the state level, subnational levels, and also at the local government level. That is where implementation must happen. So what we want to do differently, we want to support more closely the implementation at that level. RAMCA will be replicated at the state level. And our vision is to see replication up to the local government level.
There's been a lot of complaints around the hazard allowance. You were the National Secretary of Nigerian Medical Association when the COMMES, the Consolidated Medical Salary Scale, and CONHES salary structure was approved. And I assume you were part of the negotiation that sought to the 5,000 naira hazard allowance. That's about over 10 years ago. You know, so what was it like? How did you come about the 5,000 naira as hazard allowance for medical workers as at when this was negotiated with the government?
Thank you, Dr. Laz. Actually, the hazard allowance of 5,000 naira was more or less on the insistence of the government team. We knew ab initio that 5,000 naira hazard allowance for all the health workers was certainly nothing to cheer about. The NMA team then, that was in 2009, tried everything to see if it can be more realistic, but the government team insisted. And incidentally, we were working very hard to at least reintroduce the medical salary structure, which was suspended by the previous military regime. So we more like said, okay, what is offered, maybe we take it for now with the hope that in the not too distant future, it will revise upwards and be more realistic and more reflective of the hazards that health workers go through. And it's instructive that this salary structure was effected in 2009. And between then and now, the value of the naira has been devalued by over 300%. And we are being faced with increasing hazards, new emergent diseases coming up. Like currently we have COVID, and more health workers are getting infected in the course of performing their duties. And unfortunately, the hazard allowance is so low, and even the salary is such that, like I said, it's been devalued by over 300%, that it's no longer able to even assist the health worker take care of himself. And the result is that a whole lot of our colleagues are emigrating to other parts of the world, and the brain drain is real. So
Yes,
it is really time that the hazard allowance be revised to be more reflective of the hazards that health workers go through.
How best can we care about our skin? Let's begin from the normal before we start, talking about the common skin conditions.
Well, the skin, like you've rightly said, is the largest organ in the body. And your skin kind of is the first contact anybody will have with the environment, with anybody. So to keep your skin in good shape is good business.
Okay.
So it is our duty to do that and not to damage it.
So how do we keep it in good shape?
Yes, coming to that, you cleanse it. Cleanse it, that is, you use soap and water.
Okay.
Then you apply moisturizers.
What do you mean by moisturizers?
Something that will not dry the skin, something that will retain water, moisture in the skin.
Okay, like body cream?
Body cream.
Okay.
But not cream that bleaches you.
Not the one that
bleaches you, because bleaching is not skincare.
So what does bleaching do?
Bleaching removes, there are different ways you can bleach. You can thin the skin by removing a upper layer of your skin.
Okay.
You can reduce the expression of melanin in your body to make you look lighter as well.
Okay, the conclusion is bleaching is not acceptable.
Common skin dermatosis that we usually see in our outpatient clinic coming under infections are mostly either bacterial, viral, or fungi.
Okay.
Under fungal, you have dermatophytes, superficial dermatophytes. What that means is that in the common parlance out there in the society, they will tell you they have eczema.
Okay.
Yeah, eczema.
Eczema is a superficial.
Yes, mostly what they call.
For those who want to learn medical language.
Yes, so it comes like in form of, slightly a chalk-colored discoloration on your skin, in form of hypopigmentation. And they have it mostly at the back, and then depending on how, virulent it is, it may also involve the chest.
A lot of persons get concerned when they have that. What would you advise anyone that notice that in the body to do?
Yeah, I think the best thing is to see a doctor.
Okay.
Dermatologist.
Dermatology.
So
this is Hirschsprung's disease. This is also a late presentation of Hirschsprung's. You can see the...
Is that the veins?
Yeah, those are the abdominal veins that are dilated.
Do they lead to vascular obstruction to present with this kind of distended veins?
No, the problem with this patient is actually the Hirschsprung's. So you just have the veins are just being, it's the tension that is causing all this, you get.
Okay.
So your main attention shouldn't be on that, should be on what is causing the distension. Because this child is accumulating gas and feces, so cannot pass stool, and you need to relieve that intestinal obstruction. Sometimes you might have to give a colostomy, which we'll subsequently see.
Okay, we'll take a short break shortly, but before that, this Hirschsprung is the nerve supplying the intestine.
Yes.
There is absence of it in some parts, so because of that, that segment of the intestine cannot move.
Cannot move. The peristalsis is usually absent. So when you have that peristalsis being absent, subsequently, that's why it's a functional intestinal obstruction. It's not as if you have anything mechanical.
Yeah.
So what's cataract?
Okay. Cataracts have been said to be the commonest cause of blindness worldwide, which has now placed so much importance on us knowing what it is and what can be done for individuals who have it. It refers to an opacification of the lens in the eye. Earlier on, I had talked about the lens.
An opacification means?
Yes, which means that the structure is a transparent structure, meaning that if you look through it, you should be able to see someone on the other side, or light can pass through it. However, if for some reason any part of it ceases to remain transparent, which means it now becomes opaque, light can't pass through it. That means that a cataract has begun to develop within the lens of that individual's eye.
Okay, so from
yes,
it could show like this on the
picture,
right eyes.
Yes, exactly. You can see that right in the center of that, the pupil, which I had described earlier, you see the whitish coloration there. So that is a white pupil, which we call leukocoria. So cataract is the commonest differential of such a situation, okay? When you compare it to the left eye, you see that the black part of the eye is black all through, except for the light reflex in the center. But on the other side, which is the right eye, you can see that there's a cataract there.
Okay, what are the possible causes of cataract?
Okay, the causes of cataract range from trauma, injury. Injury to the eye can give rise to a cataract. Individuals who have metabolic disorders like diabetes mellitus, which is high sugar levels in the blood system, that can also give rise to a cataract. The commonest cause we see after the age of 50 is due to age.
Aging.
Yes, the aging process. So we have individuals who after the age of 50, 60 just begin to have this poor vision. We examine them.
So these are kidney stones. This is quite common, especially in northern Nigeria where you have a lot of heat and all that. Can you speak to it, please?
And majorly is because people don't take enough water.
People don't take enough water?
Enough water. If you take enough water, most times, you will not come down with stones. That's one way first way to even tell in trying to manage stones. Drinking
is there any
water.
side effect of taking
adequate
plenty water?
Of course, too much water is bad. Too little water is bad.
Too much water? Because apart from passing frequent urine.
That can be a problem because you pass more urine and then you distort some electrolytes, particularly sodium.
Okay.
And that again might not be good on the long term. So too much water is bad. Too little water too is also bad.
What is too much water?
Adequate water means that you are taking 2.5% of your body weight. So perhaps maybe if you are 70 kg in a day, 2.5 or about 3% of your body weight, equate it to how much fluid you should take in a day.
My body weight is 80%.
Yes. So
10% will be 8 kg.
8 kg.
Right?
So, yes.
5% will be 4 kg.
Yes.
2.5% will be 2.
Yes.
Is it in 2 liters?
So it's in terms of your body size. That's why we put a percentage to it.
Okay.
So usually it spans between 2.5 to 3 liters in a day.
Okay, 2.5 to 3 liters.
I mean, that covers for...
Instead of percentages. A very important message there. You have to take at least 2.5 to 3 liters of water every day to be well hydrated so as to prevent kidney stones. We'll take another break. When we return, we're also going to show highlights beginning from the rights of patients, the medicine and law, and a couple of other issues. Stay with us. We'll be back. Patients' rights that are applicable in Nigeria, right to emergency treatment.
Yeah, we cannot overemphasize these rights. Every patient in Nigeria has a right to be treated in an emergency situation. That's the provision of Section 20 of National Health Act. And the beauty of this particular provision is that subsection 2 of that particular provision says that where a hospital or a healthcare provider or anybody defaults in this, the patient can actually
go to court.
Yes, right? If the hospital is found liable, they'll pay a fine of 100,000 naira, or even a healthcare provider is found liable, the person will pay a fine of 100,000. But it does not stop at that. Secondly, the person could even go to a prison for a term not less than 6 months.
I even asked them, what time will the ambulance be ready? They made a phone call and then they said very early the next morning. So I said I was going to wait, and they tried to discourage me, saying that the oxygen will not last up to 3 hours.
Okay. All right, so let's, thanks for that account. Let's get to Mr. Shegun. You made a video where you explained, it was a very emotional video. But from the point you learned that Omolara died, what had happened between then and now, especially in your engagement with has the hospital made any statement? We've tried to get across to the hospital. That has not been successful, but can you give us quickly, within a couple of minutes, what it has been since this story went out?
Okay, thank you, doctor. So I heard about her passing on Friday. She passed on Thursday morning, early hours of Thursday. On Friday, I heard about it. Unfortunately, she had been buried.
It's also a lost death. So you can imagine what will happen when he's done with the law program. I would have liked to say your last words, but please bear with me. I really want to thank you, Dr. Dale Ogumbayo, for joining us on the program.
Thank you very much, Laz.
I'm Barrister Kenechukwu Agwu of Nulai and Sabi Law. Thanks for joining us on the program.
Thank you very much, Dr. Laz.
Okay, and to you, viewers, the essence is essentially to create more awareness around issue.
It's onus on the community to make sure that people are aware, creating demand. If there are issues that they are not clear of within the hospital, the community must be engaged to do that. Luckily for us, Dr. Laz, there's this World Health System, which is the smallest unit of health in this country. The World Health System has a World Development Committee, which part of the World Development Committee is the World Health Committee, and is made up of community people. What are their roles? They are to make sure the facilities within those wards are functioning properly. And when it's functioning, it provides quality health, staffs are there are resources there. So the role of the community is to ensure that they have quality health.
So take it up from the parts you discovered that equipment were locked and not in use.
Yes, I think we discovered one, which I can still remember. I've only seen that equipment in television. I think you're a medical doctor. You're a medical doctor, and I'm a botanist, so you should know better. It's theater light.
Okay.
And the theater light, I can say it's worth million. But the doctor said when he came, he was not given. Nobody told him about those equipment, so they were just locked in the room. So when we came for the cleanup, we discovered that there was a need for us to clean the room as well. So we discovered a lot of equipment, and as I speak to you now, the hospital and the doctor, they are making use of the equipment. And the cleanup is not just for a month. We've continued the cleanup for every month.
Last week we talked about some practices around blood. So are there some other shady practices within the medical lab that some persons get engaged, whether they are quacks, because there are also quacks who parade themselves as medical laboratory scientists, and they are not. Are there some of other practices you want to tell us about?
Yes, there's a lot. But let me quickly say one of some that are really very crucial. Like one of them in Nigeria that I've observed is what we call computer tests. There are something we call
computer tests.
Computer tests. Yes, you see some people posting like medical lab scientists, or they will tell you, or they are radiographers or something, but they just use a computer and they will screen you and tell you that your heart, your liver, your kidney, all your organs are this or that, without doing the standard, which is taking your blood sample or having a correct CT scan or other proven method of diagnosis. So one of the basic scams that people that are observed in medical laboratory practice is people opening some labs and doing some tests with a computer, and they give wrong diagnosis to patients, and patients are overwhelmed with drugs and so many things after some wrong diagnosis. So another wrong practice.
Yeah, Chibeze, before you mention that one, I want to say that, yes, I've seen this precisely at Area 1 shopping center in Gariki area of Abuja, where I went to buy something, and someone came in with a box, was marketing to the traders that he has this computer, you check your body, and it's going to check everything around your body and tell you what is wrong and what is not. And I pretended as if I was just playing along. So they'll write without actually doing the test.
Yes, writing a result, that's falsifying those figures without actually doing the test. And some of them I've observed, even here in Enugu, some of them is because the wrong professionals man those labs. You see some labs, instead of employing a medical lab, maybe science lab tech, that is not a core medical professional, working, and the person is signing results, and definitely the person will not know how to do, because that's not part of the person's curriculum. The person will not know, but because you want to maximize profit, you don't want to pay the right professionals. So you see, they falsify those results. So blood test is one of the most scammed tests for people now, because they will just write anything and tell you that your blood is okay.
This looks very scary, because it looks very scary because full blood count is one test that gives you so much information about the body system, you know. And we are bringing this, the patients just want to get better. They just want to get well. They don't know who is quack and who is not. They will go to a health facility and hoping that they get the best. But, you know, some of our colleagues are failing them. I think the authorities really need to pay attention to this, because it's not in the place of the patients to know what is happening behind the scene.
The abdominal pains, you understand? To give you pains of varying degree, give you pains of
kidney stones,
you know, any organ of the body that is diseased. The first manifestation that it may come up with is pain. And usually, if you notice that what makes people come to hospital most of the time is pain. People will not just come to the hospital for coming sick, except they start feeling pain. And that is why some people have even described pain as also a vital sign. So which means that pain on its own, not just that it is a sign, it also helps as a protective mechanism to the body. So once you start feeling pain, you know you need to do something about that pain, so that you are going to be okay.
It's with that highlight on pains and pain management that we're going to end the show today. I hope it stimulated your interest. Feel free to go back to our YouTube channel to watch as many of 65 episodes we've had so far, as many times as possible. Thank you for watching. My name is Dr. Laz Eze. See you same station, same time next week.